Hey, Polly.
Hi, Greg.
How you doing?
Good. How are you?
Doing all right. So today we have Mary-Kate McCarty. She's a co-responder and clinician with the Gateway Healthcare. She rides along with the police.
Oh,
So
what's she called?
she is the co-responder clinician.
Okay. All right.
So
Yeah.
yeah, I guess it makes sense. Co-responder.
Yeah.
She,
I've heard about that position. Yeah.
yeah. So
Interesting.
it is going to be great to hear. We're going to hear a lot about intervention and resiliency and intervention with preventionists. It's going to be good.
Nice.
All right. So without further ado, joining us today on the Totally Preventable podcast, we have Mary-Kate McCarty, co-responder clinician with Gateway Healthcare. Mary-Kate, how are you doing today?
I'm great, thank you. It's a beautiful day.
It is. It is. Mary-Kate, to start us off like we normally do, can you tell us a little bit about yourself and how you got to where you are today?
Sure. Um, so I am a co-responder clinician with Gateway. My background, I have my master's in forensic psychology, and shout out to Roger Williams for helping me with that. Um, so I have worked with the forensic population for 17, 18 years now in different capacities. I've worked in group homes, in the courthouses. I worked up at our adult correctional institution, in the intake center, and I've done outpatient counseling and court-ordered treatment and the gamut of such. So uh, back when we had the SOAR grants that were coming out for the opioid response, they gave a chunk to each of the community mental health centers to build a program with police, with the local police departments. And Gateway found me and I came in. It was a very blank slate for us. And that was in 2019. So I've been doing this work since then, but I'm embedded inside the police departments as the mental health clinician. I respond to the crisis calls as they come in. I also follow up on any calls that the officers may have been on that just have some concerns or might need social services or support or something. And we follow up on that. And it's been really great. It is preventable, like your totally preventable podcast. For all the work that I've been doing, this is prevention. It's proactive because we're right there, on scene before people get into the courts, before people get into prison. So,
Right.
um,
Excellent.
Thank you.
Can you
yeah.
share with us what a crisis response intervention and preventionalist does and how your role fits into the broader landscape of public health and wellness?
The biggest goal, I think, is diversion, and prevention and diversion. So I was trained to do my role at in the Rhode Island Hospital in the psychiatric emergency department there. And myself and the other clinicians, we do the same evaluation that is in the hospital but on the street. So when we go out on a call, if somebody needs to go to the hospital, we can help coordinate that. It's supposed to fast track some of the waiting to see a clinician inside. We've already done that piece. So it's just maybe looking for an inpatient bed or a unit or, something, see a doctor, maybe get some medical clearance. But that also allows us to say, maybe you don't need to go to the hospital and we can give the resources right there, connect them in. I can follow up the next day. We can get an appointment for some place and do outpatient. So helping kind of divert from the emergency department is huge. Also, the concept of help not handcuffs, which is a big thing for me, is diverting from our court system. So people that maybe are in crisis, they aren't making the best decisions for themselves. They're not making the healthiest decisions, perhaps. And so this kind of helps redirect and say, hey, this is more of a mental health issue. This is more of a substance use. This is more this direction rather than a criminal activity, and getting help instead of handcuffs. And that it is big for me. So that's a large role of what we do. Um,
Are you or someone else involved in all the police departments across the state?
That's a great question. So we have our state is divided up into regions, and each region has their community mental health center. And Rhode Island just made a huge transition to the CCBHCs, and with that comes mobile crisis is a big part of the CCBHC Foundation. Is how are we going to tackle our crisis, our emerging crisis here of mental health. So each region does have the ability, and so each of the community mental health centers worked with their local departments. So I work for Gateway specifically, which we cover 3 different regions of the state. We're the largest CCBHC in the state. And I have a team of other clinicians that are fantastic, and we are each embedded in different departments. So yeah, highly encourage anybody. You can look right on the state's website to see where your CCBHC is. They have 24-hour numbers. You can call 9882 and be connected in, but most departments in the state are working with a clinician or a team of clinician. If it's not somebody embedded right in the department, there's a contact, there's a space there. And that's been a really great thing that's happening here in Rhode Island.
Yeah. Yeah.
I'm not sure what our title is. We have something to do with CCBHC. We are facilitators, is that what, or host, or
Couldn't tell you.
right. And we hear about it all the time. We've had several guests involved in CCBHCs,
It's
and
growing. Yeah.
I am slowly putting all the pieces together. It's a lot.
It's a lot.
It's a good thing, but it's a lot.
Yes. I'm glad I sit in my role and not that of my directors. It seems like a lot, but a good thing.
I really like that term, help, not handcuffs.
Yeah,
I think that's really good.
that is great.
Now, MaryKate, in your experience, how do crisis response and wellness intersect, especially when it comes to like acute trauma or distress?
Yeah, big time. It is all about wellness. We go on well-being checks. That is one of the biggest calls that we go out on, is somebody is asking for a well-being check on a loved one, on a coworker, on somebody they haven't heard for, a neighbor or something. Can I have a well-being check on this person? And when we go on scene, it is looking at the holistic type of wellness. You're looking at all areas, because some, crisis can maybe come across as this, but it's because of this. So a large part of what we see with domestic cases is that, the officers will come in and it'll be like, wait a minute, there's no food. Everybody's hungry. I know what happens when I get hungry. And we need, we look at all of the wellness pieces. What is it? I'm not sure if you're familiar with the wellness wheel, the 8 dimensions of wellness, or pillars of wellness, however you want to say it. Everybody should know it. That's a guiding force between everything of what I look for is, how are we on this wheel? Where are we filling up, and where are we depleting? And that makes the difference when you're trying to figure out what's next. Like, where are we going with this? How can I help you? And if somebody is in acute crisis, they might not be able to communicate that. So it's kind of putting the puzzle pieces together of what's going on here. And that's where, going to the hospital might be the best option, because it might be something medical we have to wean out and make sure that there's not something going on that's medically related, rather than a mental health crisis too. So
we have a wellness wheel here, and we try to do something daily as a team, sometimes separately, to contribute to our wellness. So
fantastic. That makes me so happy.
There's a few of the segments though that I think we're going to struggle with as a team, how do we do financial literacy as a team, but we'll figure it out. But but super important for everyone to recognize all those parts of that.
Yeah.
Mhm.
Yeah, because that is crisis. Let me tell you, financial literacy is a crisis
Yeah.
for many
Yes.
people right now.
Right.
So
Absolutely.
when
Yeah.
we look at, hope, the idea of hope,
Mhm.
when you lose hope, that's when it gets concerning. So things.
Yeah.
Yeah. Very true.
When people think of crisis response, they often envision emergency situations, but your work also emphasizes prevention. Can you unpack how proactive wellness strategies contribute to preventing crisis before they begin?
Yes, it is a lot of responding to the crisis.
Mhm.
But when we can kind of look again, when you look at that wellness wheel, or you kind of know, or a you get to know your community, you get to know your families. One of the things that I love that we've started doing with our department and with our program is a community events.
Mhm.
So having like we work with Cranston Police, so they really embrace these events that were community outreach program, and just throwing a party kind of, and having everybody get together, recognizing faces, safe faces, so that, if you are in crisis, somebody that you can call or who to call. It's a, familiar face, where to call. So at these community events, when we can do tabling and giving out information, um, there's in Westerly, I'm very grateful to the Westerly Police Department. They kind of turned one of their substations into a resource center. And so we also work with the Wellbeing Collaborative. So shout out to the Wellbeing Collaborative down there. And they put out these QR codes around the community. And the officers also have business cards too that have the QR code. So you can look up resources. You can look up all of the different things in the area to see, get help before you need help,
Mhm.
get information before you need information, and know what's out there and what's, useful. Oftentimes the officers will send me reports and they'll just be like, that was just something, we cleared the scene, it was fine, everybody was fine. However, we just noticed maybe they might need something else. Again, with the food or the financial or just resources and providers, and we have a provider shortage. So, making sure people know where options are, where to look, or what to ask, how to navigate the system. Um, that is a huge part. Um, so being able to, look at, again, I'll use your podcast name. What is something that's totally preventable here? What is something that we see in our communities? I work directly in the police department, but I work with all the providers in the area and with, the day staff. So how can we look at things to say like, oh, this person could really use an outreach tonight, just to check in, a phone call,
Mhm.
anything that's like, it could be something as simple as, wow, like, it's 8 o'clock at night and you're calling me just to check in. We're like, we knew you had a rough day and you weren't getting home till later. So your team asked me to reach out to you, or, somebody just asked me to check in with you tonight. So it's a big part. Connection is everything.
Yeah.
Yes, it
Mhm.
is.
We in almost every podcast, I think people mention connection.
Yes.
How important connection is. No matter what the subject is, everyone talks about how important connection is.
It's probably one
Yes.
of the most overlooked things as well.
Right.
Yeah.
It is.
Yes.
Mhm.
Yep.
Now, resiliency is something that we hear a lot of. We hear that word thrown around here and there. But what does resiliency mean in your line of work?
Yes, in my line. When you look up the definition of resiliency, they use the word resilience in it.
Mm. Oh.
um, Resiliency is a huge part, because when you have foundation and groundedness in life, you are more likely to be stable when the big wind blows your comes in and knocks you or tries to knock you down, the stronger your roots are. So that's kind of what I look at as resiliency is, how deep are your roots? How strong is your tree trunk? Um, when I think about resiliency in my role as well, it's twofold. So I serve the community. I'm 100% here for the community. That's what this program was designed for. But I also work with the first responders, and their resiliency is really important to me, because we're all kind of meeting people, and every day is everybody's worst day when we encounter somebody. So when you think about the wellness wheel, when you think about what is resiliency to each individual person is different. And so encouraging people to think about what's going to be your weakness, and really, acknowledging that everybody has weakness, and what's your strength, and acknowledging everybody has strengths, and being able to really shine the light on both sides. I work a lot in the darkness and people's shadows in their worst days. Again, it's their dark side, but I do know resiliency is that part of enlightening your dark sides, really embracing that you've got good days and bad days, and good sides and features and all the things. So once we learn to accept who we are, and more comfortable with who we are and what our life is, then the more likely we will have resiliency, foundation and grounding.
Like that.
Having been in the field, can you share a moment without, giving anything personal away, where that really illustrates how important having crisis intervention is?
And many moments. Many moments. I'll start by saying crisis intervention, and if you hear CIT, crisis intervention teams, that's a big thing. That's nationally, we're really moving in CIT or CRIT, which is crisis response intervention teams. It's an international program as well. The team part of that, when you call for police or you call 988, you're going to hopefully get a team of people. And so, for an example, we come on scene, there's been multiple calls and multiple situations where I'm directed at the person. So before I can make any decisions about if a person needs to go to the hospital, or if I'm going to send them there against their will, take away their rights and send them there, I have to see them. I have to have eyes on. I have to try and have a conversation. I have to physically see them myself. So I'm focused on that person. Going with my CIT officers, or, there's many, many great officers that they're looking at the scene. So together as a partnership, I'm getting information from a person or from family, collateral, anything, but they're also kind of looking around. And there's been a few times where, they'll come over and be like, did you see that in the corner? And it's, one time it was some belts that looked like they were in loops getting ready, and I was so focused on this, but if my partner over here hadn't really been looking around, we would have missed clues. There's, and times where, when one time, because help not handcuffs is the goal too. You get an emergency call in, you respond to it. The call is going to change probably about 5 or 6 times before we get to the place. More information coming in, all this. It's not ever usually what the call originally comes in as. So when you get there and you're looking around, and there was one case, there's been a few cases again of postpartum women. And if you're not familiar with postpartum depression, or depression in general, it can lead to a psychosis. And so we're, be responding on scene, and the person is experiencing delusions or hallucinations. it looks like it might be an illness, or that they're lying because there's no history, or there's something else here. But I remember one time I'm just looking around, I'm like, oh my goodness, this poor woman has a baby on her hip. She's got a baby in a basket. She's got another, young child over here, and she's looking for one of her older children, can't find. And come to find out, it's postpartum depression. We start kind of asking the questions, and the officers are picking up that nothing's making sense. So when we come together as that team, and we're like, wait a minute, I think this is something else. And the worst possible thing in most cases for postpartum women is to separate from the child. So back in the day, it would be. And this woman had that experience too, in one case where she was taken to the hospital because it is presenting as a medical unexplained, mental illness. However, that wasn't so conductive. But we were able to determine, yes, you're in care. You just started some new MaryKate. You're starting a new group next week. Like, okay, this is what's coming on, pieces together. And no charges for a 911 call that was false. No charges for, anything. There's a lot that comes with responding to emergency calls. So, the first responders have to have laws that protect them from, going out on something that's not real. However, this was very real to this person. And as a whole, we can recognize that and say, you know what, this is something different. So, let's get help. Let's get help. Let's focus on that. And then, not the case. So there's so many calls that we've been on where I've had collateral information, or I've had medical information that I'm privy to. I can't share that with the police unless it's that emergency situation. But if we arrive together, I can kind of say, there's some things that I'm looking for here. I want to make sure that they're eating. I want to see them drink water. I want to see them walk. I want to see certain things happen. So if we could figure out as a team how to see these things. And usually when we see those things, or don't lack of seeing those things, it opens up this whole new thing that, maybe if we hadn't been there as a team, as a crisis intervention team, looking for these factors, people wouldn't be getting the help that they need for what they need it for. And communicating with the hospitals, then I can communicate with the hospitals too. So people will say what they want to say when they get to the hospital too. People will say what they want to get when I arrive. But as a team, we kind of work together, and there's so many instances where, it's a collective effort. And, the other day I was on a scene, a person did not want to hear what I was saying to them. Understandable. I don't blame them. But my partner, the officer that I was with, was fantastic, and just kind of was like, you know what, when you stop taking care of yourself, we have to step in and take care of you. And that was everything. That was the essence of all that we do. Because when people give up on themselves, and you have loved ones saying, can you help them not give up on themselves? It is a first responder or the crisis intervention team clinician to come in and say, hey, we've got to make this decision for you. Let's get you some help. Oh yeah.
Every time I've seen MaryKate, she's always bubbly, a great personality, energetic. I would love to see you on a call where it's like all business. I probably wouldn't even recognize you. Like, what? I'm sure when you're telling people what it is that you do, or describing your title and the work that you do, that there must be sometimes where you're coming across some misunderstandings. So what would you say would be the some of the most common misunderstood aspects of your work?
People always think that they're in trouble.
Mm.
A lot of people think that they're in trouble or they've done something wrong. And when police respond, there's this automatic feeling. So I'll just say that too. We have a misunderstanding about our police force, our law enforcement in general, first responders in general. I think when I come on scene as the clinician, it's pretty clear what I'm there for. They kind of, everybody in the situation kind of understands, all right, they've brought a mental health clinician here, and a person that I'm speaking to might not be based in reality at that moment. So misunderstanding that for me is expected. Um, I, I would say as a collective, though, misunderstanding that we have so many officers that are trained to also come in with these skills, that innately have this, that chose to be in this work. And there's a lot of misunderstanding when we come on scene, or we come on scene together, like this is a partnership here, that what that's going to look like, and the fear that comes, and the fear that has come and has reason for it in the path, but we're moving in a new direction. So I think more awareness about how that direction is looking. The evolution of policing, I think, is a misunderstanding. And I see it directly in mental health, criminal justice. I've been dancing the bridge in between these two lines at very different silos of existence, and we have misunderstanding just within our systems of what that looked like. The police are making all of these guidelines and laws and passing pieces on their side to do better. But the mental health side is also maybe not so aware of all of this, and we're always changing with our things going on. So there's the communication, connection, may I say again, between that. I think that's where the misunderstandings come about the most. I know when the police bring somebody to the hospital, or the fire departments or EMS, when somebody is getting sent to the hospital, there's misunderstandings there. The hospitals, I've had hospitals say to me, well, the patient is saying that the police beat them up and dragged them here against their will. And I was there. That wasn't exactly how that went down. And it's, who do you believe? And it's where do we get, and how did we get here? Like if the officers are bringing somebody to the hospital rather than detaining them, that should be a good thing. That should be a good thing, but our hospitals are overwhelmed. Our emergency departments are, not so equipped for somebody in a psychotic episode oftentimes. So it's just the misunderstandings, I think, come from a systematic standpoint as well, and that trickles down to our community. So I would really like to see more communication and connection in that world, and embracing evolution, because change is hard. And misunderstandings and miscommunication happens when you don't have the same language, and there's a lot there. So working together, I think, would help kind of create that space for less misunderstandings. I think that's more the case. I'm pretty sure people know what I do when I show up. But I don't know if everybody else gets the credit that they deserve for what they're trying to do. And that's understandable.
Are there other people that you collaborate with besides police to make your team better? Or maybe even some people that you'd like to collaborate with?
Oh, oh. I would collaborate with everybody and anybody.
All right.
I'm very, very grateful for the resources around that we have. Sometimes it's few and far between to find. I primarily work in the South County region, and it's spread out. It's not the same as Providence, and all the resources that might be up there and accessing them might not be great. So anybody that I can work with or collaborate with, we have a lot of great partnerships. Again, the Wellbeing Collaborative down there, I can't speak highly enough about that group of people. That's providers from all different sections. So I'll constantly get information about new programs that are coming, or anything that might be useful to somebody that I see. Because when I'm on scene and I don't want some you know, it doesn't look like somebody needs to go to the hospital. Doesn't look like they need it, but they need more. I want to be able to hand something and walk away. I give my card, you know, they know that they can always call 988, which I hope everybody knows you can call 988 is our national crisis line. But having resources, having a sheet of paper, we had street sheets. I know that they're still floating around there in Rhode Island. Each region had a street sheet. My our co-responder team for each of our regions, we've created our own resource sheet. So when we go out and we're staying, oh, well, you know, we're not going to stay or anything, hand them a resource sheet. It's got you know, all of the coordinated entry number for housing. It has some of the shelter numbers, has behavioral health, medical, dental, just some chunkings of where you can start to call. Hotline numbers. It's just a sheet. Just hand them, leave it with somebody. That's so important. There's a lot of times, you know, the fatherhood initiative through the you know, a parent support network. I encounter a lot of fathers that are really struggling, struggling to be fathers, struggling to be men, struggling a lot. So I'm knowing that off the top of my head and like, hey, you know, there is a support group for you. I know, you know, I know what would be beneficial if you want to hear some information. I carry pamphlets. I have a whole binder, my clipboard that I come out with. And anybody that I can collaborate with would be great because you never know what somebody needs. You never know what the crisis is about. So any little piece that I can have on the back of my head is so great and so useful. And
Oh, go on. Sorry. I didn't mean to cut you.
oh, I could go on forever about that. But thank you to all the people I work with.
What do you classify as a success in your intervention?
I gotta say, this is a trigger question for me.
Oh, sorry.
How do you measure success? Um, we joke about that because how do you measure success in crisis? I didn't get any calls today. That's great. Is that success?
I'll take that.
Yes.
That as an answer.
Yeah, you know, our suicide rates are going down. Success. That's a success. I will say it's hard because we are a data-driven society. So when I don't get any calls tonight, there's no data saying what is happening. So
Right.
how do you measure success?
Right.
How do you measure that nobody, you know, hurt themselves today because of that pamphlet I handed out?
Mhm.
You know, how I don't always get to see, I don't get to see usually what's next, what happens next. You know, I arrive on scene and I kind of pass the torch to the next healer. I don't have access to their charts anymore. I have nothing because I'm just emergency services. So I don't always get to see the other side. And I think in general for first responders, you don't get to see what happens next. You don't get to maybe see what success looks like for somebody unless you bump into them on the street or they stop in and say thank you or, you know, something along those lines. It's hard to measure that. And I've been asked this question before, and every time I'm like, I want to get real sarcastic.
Well, thank you for not doing it here.
Oh, I was gonna say, I'm sarcastic. I
when you
Maybe
get when you ask the question, they need to.
I do. I want it triggers me to be like, what do you, how do you want me to?
Of our mental note, don't ask Mary-Kate.
Because how you know, how do you measure that? And that's something that collectively as society. So earlier you asked about how, you know, how this public health as a whole,
Mhm.
when we think about crisis or not, you know, what is this? But healing's not linear either. So when we go out to a house several times, it's not because it's not working. It's, you know, mental health and mental illness, mental wellness, all of it is not linear. We have good days and bad days. So the pressure to measure success I suppose is what triggers me. We want success. We want to see it. We want to know it. But we also want to recognize that today might be a successful day. Today might be a good day, or even helping somebody. Okay, so I did go out on a call or a few calls, but hey, they felt pretty successful walking away. It felt pretty good. That's success to me, of walking away and just being like, you know what? That felt good. That was not what we expected. This went the best possible way in the worst possible scenario.
Mm. Like that.
That's that's success too. Little things I learned when I worked in the group home, we learned to celebrate everything. And I definitely forced the officers that are around me to kind of think that way too. Like, well, let's cling on to these little things, because sometimes that's what you get today.
That's right. That's
Absolutely.
right.
Looking forward, what changes or advancements would you like to see in your field?
More. More crisis clinicians. It's a special niche field. It's not for everybody. I'm not sure a lot of new clinicians know this role exists. I didn't until I got here, and I was like, this is great. So working in emergency services is very different than being a therapist. Many of my friends prefer the therapy side. I like the crisis work. We need more. We need more clinicians that do this and like this, and for the right reasons are here and have the best interests of the community in mind, and more de-escalation training for everybody. That's huge, being able to kind of have communication and connection. That's more of that. In general in the community. So we do so much community work. So more connection, more community, because that's crisis prevention. That is, I get dings for your podcast there, but the totally preventable stuff is when you have friends, you have neighbors, you have people around you, you know the safe faces. So more connection to the community. I think that's key factor of just, knowing who to call, knowing if I call a crisis line, who's going to show up, and knowing there's a crisis line to call. More information, more education, and more, I think, just bringing that hope into the community. I think we need that, kind of getting on the same page. We have a lot more in common with each other than not. So the more we connect and gather together, the more we'll realize how much we have in common. I think people are quite amazed that a clinician is in a police department. It was such an easy transition for me. The departments are so welcoming. More. They said more. Thank goodness. We don't know what, more of this. So who'd have thought? I did it. We had no idea. And that's exactly the response that we've gotten, and everybody seems to have gotten as well. It's just, who knows how we can get together. So connection, more of that, and education and funding. I guess I could say the F word.
Yeah.
More funding for this.
Can people call and request a crisis intervention team? Like, if no matter where they are, like if someone in my family was having a crisis and I needed to call the police, could I request that someone come with them to make sure that they realized what was going on?
Yes.
Okay.
Yes, please do. Please do. That kind of sends a little bit of a message of what we're looking at as well. Again, we don't have a guarantee that you're going to have a crisis intervention team on 24 hours. We're getting to that place. Most departments do have an officer every shift at least. But if that officer is tied up doing something, or if the clinician is tied up doing something, it's challenging. But when you say, I'm looking for a crisis intervention team. The dispatcher knows whether you're calling 988, if you're calling our, so we have 24-hour number through Gateway. Most the CCBHCs have the 24-hour number. There's mobile crisis teams, which is different than the co-responder. A mobile crisis team is a clinician and a case manager going out. They go out without police. So if you're calling and you're asking for crisis intervention team, you can say, I don't think that the police need to be there. There's no, imminent safety. Because once you get into that imminent safety piece, that's where we want to have police first responders coming in. So clarifying that right from the start so that dispatch is already thinking, okay, I know I'm going to start to look at this route. We're going to look for a mobile crisis response and have the clinicians come out. And then they can determine whether or not they want to call the police too, because that's always an option. But if it's something they can handle, without having that response, that's the direction to go. So when you call in, absolutely ask for the crisis intervention team and explain what the behavioral health concern is. Clearly, if you know that there's weapons or there's not weapons, clearly stating that is really helpful. And the likelihood that you'll either get an officer or a clinician trained in the crisis intervention team is significantly higher. Or an officer that has those innate qualities, because there's a lot of them. There's a lot of great officers that can respond, and if they know what they're walking into, know how to respond, that's a lot easier for them because they're going from call to call to call too. We're all going from call to call. I'm always in my clinician hat. But knowing, hey, is there a crisis intervention team available? My family members is really going through it. Not sure what's going on. They need an evaluation. That is, yes, please do more of that too. More of that. When you're asking for a well-being check, is there a crisis intervention team? I think, my loved one's in crisis.
For listeners and viewers who want to learn more or to collaborate or to get involved, what's the best way for them to contact?
Right to your CCBHCs. That's where I would start. So there are 24-hour numbers. Most of the time it's the same day number for the agency. You can contact your police departments, fire departments, contact your mayors, or your town managers, town council. The pressure of having crisis intervention teams is what we need. So knowing that this is what you want your departments to have, knowing that this is, you want to know what's going on, knowing that you have a department has it. So some people are saying, yes, we want this, but you might not even know what they're already doing. So many across the state are already doing this across the nation too. So communication, talking, just in general, taking care of yourselves. Wellness wheel, look for your wellness wheel, know it for yourself. That saying that put your mask on first. So make sure you're taking care of yourselves before you're worrying about what everybody else is doing. That's
Hard.
that can be really helpful. When you do see something, say something, and that can be used in so many ways. But if you see somebody is just off, if you see, somebody's had a few off days, and that can go either way. So somebody that might be very quiet generally is all of a sudden on the other side, flip side, really happy, like it's just a different presentation, and it's kind of like, well, it's not usual, but this is lovely. That can also be a warning sign. On the reverse side, somebody's always bubbly and they're down. That's something we're like, oh, is that person okay? But it's changed. So if you notice changes in somebody, if you just know, or if you haven't talked to somebody in a while and they come to your mind or something, reach out to each other. Kindness. We need a lot more kindness. As I said earlier, we have a lot more in common than I think we don't, and we're in a very divided society. So trying to find kindness, trying to find commonality, if you can, when you can, if you can't, walk away. Walking away is good. Put down your phone. Stop the doom scrolling. If you're going to doom scroll, what do you have your feed filled with? Does it have your podcast, your Totally Fundable podcast? Does it have all the things that's feeding your brain with healthy stuff? If, we need a lot more of that focus. We can get sucked into the news really easily. And it's always there. It's going to be there when you come back.
It is.
Taking a step back and getting grounded and you know, having some fun, remembering what fun is like, catching the sunset.
Mm.
You know, sitting, having, my father always taught me there's always time for a cup of coffee with a friend.
Wow.
Always time for, so I cling to that. When I do a lot of the officer wellness training piece, the resiliency on that side, and that's huge. So there's always time for a cup of coffee, a cup of tea, cup, whatever, something with a friend, catch a sunset, catch a sunrise, actually watch it. Yeah, I ask people, when was the last time you saw the sunset? It's like, saw it, not just like, oh, saw it, sat and watched it. You know, going back to kind of some of these simpler things that seem so simple, but doing that and doing that together, you know, asking that friend you haven't talked to in a while, hey, you want to get a cup of coffee? Hey, you know, I was saying it's going to be a beautiful weekend. You want to go for a walk or something? And you never know how you're going to change somebody's day with a smile. It's just, it's simple, but it could be life-changing. You don't know what seeds you're planting.
That's right.
Yes, they are.
That's right.
Thank you so much for sharing all of your knowledge with us. This has been a wonderful podcast and uplifting.
Very uplifting.
Yeah.
I
Bet you didn't see that coming.
No, it's the strangest podcast. Sometimes we're like, oh, it's going to be kind of a bummer or whatever. And people surprise us and bring positivity to, you know, some things that maybe sound like they're dark and heavy. It doesn't make them not dark and heavy, but it, you know, able to bring a different perspective. So that's always good.
Yeah. Well, let's normalize the darkness.
There
You
we
know,
go.
we talk about destigmatizing mental health all the time.
Yeah.
Let's destigmatize our shadow side.
Right. Right. See, we all have to have an inner MaryKate.
Yeah, I feel like I embrace my shadow side.
I'm not gonna say I.
I always joke that my light on the outside is as equal to the dark on the inside. So it's balance.
I need to get there. MaryKate, this has been great. Thank you so much for your time and for being a guest.
Thank you so much for having me. I'm truly grateful for the work that you guys do and spreading information and again, that's connecting people. So I'm very grateful to be here. Thank you so much.
You take care. Have a great
Thank
rest of your
you.
day.
You as well. Thank you.